Welcome back. In our first videos, we looked at the ways you can help others see you in the most positive light. See you for your authentic self. We talked about how you can prepare yourself internally so you can operate as your best self. We learned that who you're being is as important to your success as what you're doing. And we learned how what you wear can either open doors or close them. It's all about being able to tune into other people so you can connect to them in an authentic way. After all, if someone doesn't like you for who you authentically are, why would you want to work with them? Now you're getting ready to look for your first nursing job, and that means you're going to have to interview. In this video, you'll learn how to decide where to apply and what sort of nursing career you want to pursue. You'll learn how the contacts you make in nursing school can help you when it comes to looking for your first job. You'll learn the power of journaling and how to prepare for an interview. And you'll learn how to do your interviews right. There probably aren't very many situations in life that feel as stressful as an interview because you feel like everybody's judging you. It's awkward, and it can be a little weird, but it doesn't have to be. So let's talk about what an interview really is. First, you are not on trial. No one is going to find you guilty. You're there because you've got the qualifications. But that doesn't mean you're right for every nursing job. An interview is, first and foremost, a social interaction. It's meeting someone new, finding out if you like them, seeing if you feel like you fit in. Think about people you met in nursing school. Some you connected with, some you didn't. It's no different when you apply for a job. Maybe you'll connect and maybe you won't. If you don't, you move on. So an interview is as much about you finding out if you want to work at a place as it is about them deciding if you're right for the job. And finding out what you want can start while you're still in school. In video 1, we talked about how it's important to know yourself. Here's one more place you have to know yourself. What do you like doing? In your clinicals, what did you love? What did you hate? Would you be happier in a big hospital or a small clinic? Is there a particular kind of medicine or type of patient you relate to more than others? Is there a kind of practice that needs nurses now, or one that others are less likely to apply to? You need to be asking these questions all the way through school. But don't limit your options. You're not done learning about yourself. While you're on your clinicals, anytime you find a place where you'd like to work, find out the name of the nurse manager and introduce yourself. Tell him or her that you love their floor and think you might like to work there when you graduate. Ask for a card and then ask this. When I apply, may I send you an email to let you know so my application doesn't get lost in the pile? Make as many of those kinds of connections as you can. Send them each a thank you note, and then when you apply, send them that email. Nursing school can be as much about preparing for your interviews as it is about preparing for your career. So we asked a real recruiter for some advice on making sure you're ready for your first interviews.
We encourage individuals to have a journal. So in nursing school, journal those experiences, because when you get to the interview process, it's so much easier to refresh back on that and be able to, look at your experiences, because you're going to forget from day one what you've experienced, and you want to be able to share that because it's going to show how you've handled those situations, and it shows your critical thinking skills too in that pattern. And pull that little journal out, refresh on those thoughts, and involve your co-students, because those are your teammates that can help you. And you want to maybe do some mock interviews with each other, because a lot of places will do panel interviews. We'll involve those students, maybe get 2 or 3, and take turns being the interviewee and the interviewer. And just have fun with that. If you practice it, it makes it so much easier when you go into the actual interview. You're used to seeing 3 people stare at you.
It's like preparing for anything we do in life. The more you prepare, the more ready you'll be in the interview. Now get on the internet and start doing research. Find out everything you can about the facility. Check out sites like Glassdoor.com and see what others say about the interview experience. See if you can find anyone you know who works there or who has interviewed there.
Research not only of that facility and knowing that facility and what their expectations are, what type of facility it is, also research why you're interested in working there. So know those things about yourself. And when you go to that interview, you're going to be real. You're going to come across more authentic because you know that you're going to have an interest. That's what you want to show. Number one, we want you to be professional in the field of nursing. We want you to talk about being a team player. We want you to be able to share your past experiences. That may be their clinical rotational experiences, that might be their extern experiences, leadership role experiences, volunteer experiences. So we want them to be able to share that verbally during the interview process.
Remember, if you're in the interview, it means you have what they're looking for, at least on paper. Now, they want to see what you're like as a person. Are you a positive person? Are you relaxed and able to smile? Are you able to talk honestly about both your strengths and your weaknesses? And if the going gets tough, will you lose your cool?
If you're handling a rough interview, take a deep breath. Let the team know that, that sounds like a difficult question. I just need just a second. And take a deep breath and just a calm, and then focus. If you don't know a question, an answer to a question, or you don't have an experience like that, just stop. Let them know that, I haven't experienced that. This is what I would do if that occurred.
Be honest about what you know and don't know. And don't worry if you miss something. Remember that everyone else who's sitting where you're sitting is just as unsure and uncomfortable. What recruiters will want to see from you is really the same for all of them. Do you have good communication skills? Are you able to speak clearly and tell people what you know? Even more important, do you have good listening skills? When they're talking or asking you questions, is it clear that you're really listening to what they're saying? Or are you just thinking about the next thing you want to tell them? And one more thing, and this is really important. Did you turn off your cell phone? Even worse, did you forget and did it ring in the interview with a really dumb ringtone? Think about your social skills, because believe me, your interviewer will. They'll notice if you didn't arrive on time or weren't ready. They'll notice if you complain about the temperature outside or the parking in their building. They'll notice if you don't look them in the eye when you shake their hand or when you're speaking. The most important thing, they want to know what you stand for. Why did you become a nurse? Is there a medical story in your life? A moment when you said, a nurse, I want to be a nurse. And they want to feel that you are really passionate about your career. That's a story you should work on. Tell it to friends and family until you really know how to tell it, and you can see that your story lights them up.
Passion does need to come out, because when you're talking to a team, they want to hear why you're interested in that particular area, that particular track. They want to know why you're interested in the medical center. They want to hear from you why you are interested.
Make sure you get the interviewer's business card, and unless they ask you not to, send a follow-up email. Thank them for seeing you. Tell them how impressed you are with their facility, and tell them again why you want to work there. Remind them why you're passionate about being a nurse. Keep it short and sweet and to the point. And then, journal about your experience. Write down what you think went well and what you think didn't go well. Then, before your next interview, review what you wrote. And if you don't get the job, don't worry and don't take it personally. It doesn't mean you weren't right for the job. It just means the job wasn't right for you. You'll get your job, and it will be a great one. In this video, We learned how to decide where to apply. We learned how you can use the contacts you make in nursing school to help you land your first job. We learned the power of journaling and how to prepare for an interview. And we learned how you can be a great interviewee. Interviews don't have to be stressful. Enjoy the experience and don't take it personally. You'll find the right job and you'll do great in it.